Currently, Banner Health handles about 4.2 million calls through our centralized call center. We have code blue notifications. We're handling messages of code triage. We have code pink. So a great deal of critical mass messages are coming through the call center 24 hours a day. So currently in Banner Health, we use a variety of Spok products. We have our operator console. We also use the on-call scheduling, which allows for users to be able to enter schedules directly into the operator system. We have critical messaging that goes through our Spok system. And we have an IVR in use, which takes advantage of the speech recognition that Spok has. We chose Spok for a variety of reasons. The main reason was their extensive experience with healthcare. They knew our business, and that was important to us. They had products that would meet our needs without having to make custom changes.
Spok has helped us improve patient care by being able to communicate with families. A lot of times, because we are in private rooms, they get afraid that the baby's alone. So by us being able to tell them that the monitor is attached to our voice badge, even if we're out of the room, we're always in communication with the baby. So that makes them feel much more comfortable. Also, if the nurse is feeding the baby and the parent calls in to see how their little one is doing, the calls can go directly to our voice badge. Our unit secretary up front will connect them to us on our voice badge, and we're able to talk to them and tell them the weight or whatever's going on at the time.
Spok fits in very uniquely in the sense that it allows us to be able to get the communication out to our voice badges, to get that message, that critical alert to the clinical staff so they can act upon it. The technologies are very unique in the sense that it allows us to get into that granular detail that we need to capture that specific monitor value from our monitoring systems that is a critical alert. Then the staff is aware that something is going on with their patient.
So prior to having the Spok solution, we were doing manual processes for our code blues. Nurses were having to leave potentially a coding patient to make a call to the operators and let us know. We would then process that call, send a notification manually. So once we've got this Spok solution, this all happened electronically. Nurses pushed a button at the bedside and the operators instantly had all of the information that they needed. Not only that it was a code blue, but what patient room it was in, what facility, and any other detailed information we would need to make that announcement.
Spok has enabled all of us to do our job better because we're communicating quicker. I have the ability, or any of us have the ability, to do a general broadcast. So if you're needing to reach all of the staff on that day, you can do a general broadcast. We also, in our unit, go on deliveries. So we'll have something called an urgent broadcast. So the urgent broadcast, for example, will get the right person at the right time to the right place.
Spok is a very unique company. They have been marvelous in the way that they've helped us implement our technologies. They've been great with their support models and being able to get support right away when needed. The technology is first rate. It allows us to be able to get these messages to our staff in the appropriate timeline and in the way that we need to. So I've thoroughly enjoyed working with Spok and the technologies that they have, and their support structures, and the way that they're constantly trying to improve.
Spok solutions have really made a difference in patient care and Banner Health. In the operator area, that reduction of time in calling a critical code is significant. It really makes a difference in the lives of our patients.